And now we check through our report file for the evening, 4 reports compiled by our correspondents. The First Lady of Ogun State, Bamidele Abiodun, has commenced a 7-day medical and surgical outreach for residents of Shagamu and Ayekpe in the Ogun East Senatorial District of the state. The medical outreach, held at the Olabisi Onabanjo Teaching Hospital and Ayekpe Central Mosque, is targeted at about 120 indigent members of the state as a team of doctors from the United States of America perform surgical expeditions to reduce avoidable death. Our correspondent, Jumoke Adibare, has the details.
Good health is wealth. A healthy population is no doubt an added advantage to the socio-economic and political development of any given society. This may have informed this gesture by the wife of the Ogun State Governor, Bamidele Abiodun, to commence a 7-day medical and surgical outreach for residents of Shagamu and Ayekpe in the Ogun East Senatorial District of the state. According to her, about 120 residents who could not afford the exorbitant cost of medicals are being targeted to benefit from various surgeries. While promising to extend the gesture to other parts of the state in due course, she charged residents to take responsibility of their health to ensure a healthy living, productive society, and avoidable deaths.
Ogun State is committed to efficient healthcare. For instance, when we came in, we met a couple of people who have been waiting since January of this year, some since December of last year, have not been able to afford to pay for their medical interventions. And we are now partnering with these doctors who have come all the way from the United States, about 20 of them. They've done this mission for about 10 years now. We just jumped on the bandwagon in 2019 when we came on board, and we've supported them every year since then. And of course, like I said, the purpose is to help people who are not able to pay their medical bills.
The outreach, in a way, is to ensure transfer of knowledge from the visiting doctors from the United States of America to medical personnel at the teaching hospital.
Some of them are Nigerians, some of them are Americans, indigents, and they're carrying out very interesting surgery. For instance, today they're doing a lot of thyroidectomy, which is a major surgery. It takes 2-3 hours, and normally this surgery will take about 5 days as inpatient. But the technique they're using, the anesthetic technique they're using, is quite impressive because the patients are going home the same day. What does that mean? It means that the cost of healthcare is cheaper for the patients. But for this mission, the patients are paying nothing. The gain for Ogun State, which excites me, is the skill transfer, because our anesthetists will now learn to do their anesthetic in a different way. The patient doesn't have to be fast asleep and then recovery taking 2-3 days. They can go home the same day. So they also brought technology to help them, locate veins easily. So this is exciting times, and we would like to collaborate with them.
We came for all kinds of intra-abdominal surgery, except for fibroids. Intra-abdominal surgery related to pancreas, liver, breast mass, thyroid, neck mass, any kind of swelling of the head. But unfortunately, when we get here, there's so many people with goiter. There's too many that we have to do as many as 13 or 15 per day. And goiter is more, it's considered major surgery. But now with this transfer of technology I'm talking of, the medication we're using for them, it will just reduce the pain so drastically. So within 2 hours, they're up on their feet. Before that, they're going to be in ICU for 3 days. And ICU per day is at least 300,000 naira per day. The vent, to be on intubated, maybe 200. Oxygen, another 100. So that's the biggest transfer of technology. The other one is we have our vein finders. We can easily use that one to see if there's any complications in their veins.
It was a big relief for some of the patients and beneficiaries, especially this 65-year-old man who was operated free of charge.
I really want to commend them, and I say thank you very much for what they have done for me. I was diagnosed with a hernia. So, and they conducted surgery on me successfully, free of charge. They didn't ask for anything from me, so they did it free of charge. So, and it went successfully.
The next phase of the medical mission is to focus on heart surgery for those who need it. From Ayekpe, Ogun State, Jumoke Adebari, reporting for KAFTAN Television News.